Imagine this. You have a serious illness and have been given only months to live. How would you want to spend your last days? In the hospital, a nursing home, or what about in your own home or that of a loved one? With hospice care, you can make that choice. You can live your last days surrounded by people who care. More from the staff at Mayo Clinic.
Remember this one?
Esther Matthews is dying of cancer, but instead of living her last months in a hospital or nursing home, she's at home with her daughter Joan and son-in-law Lauren.
I'm happy I don't have to go to a nursing home.
Thanks to hospice care. Hospice is not an attempt at prolonging life or hastening death. It's a philosophy of care that allows the patients and their families to make the dying process as positive as possible.
We've had this beautiful time together, and I know now that I could never have done this myself.
Hospice addresses medical, physical, emotional, and spiritual needs. Doctors, nurses, social workers, chaplains, and volunteers work together to make sure patients maintain dignity and control. Melvin Pepper's wife Lorna chose hospice when she was dying of cancer. Now Melvin's a hospice patient too. His 86-year-old body is failing.
All right, let me just check your heart here.
3 days a week, a nurse visits him.
When she leaves, that I don't feel empty. You know, I feel like I'm full to the brim of love.
Melvin also gets visits from Jim, a hospice volunteer who admits it can be tough to grow close to someone who's nearing end of life.
Rather than emphasizing the loss, I think we try to emphasize making the days we have left as good as they possibly can be.
I remember my early days of nursing when people died alone in a room, and I always thought this is not right. And now with hospice, where people can be in an environment like this, with their family, surrounded by love, surrounded by friends, and be in their own home is wonderful.
Hospice care is covered by Medicare, medical assistance, and most commercial insurers. Patients are eligible for this care whether they're at home, in assisted living, in a group home, or a nursing home. For Medical Edge, I'm Vivien Williams.